Back now on Triad Today, and I tell you what, we have an interesting topic coming up that I have never in my life heard about, and we're going to find out all about it. Jay Paul, our director, let's meet the lovely Sarah Jean. She is certified family nurse practitioner with Deep River Health and Wellness. We'll tell you where that is later. A Cornerstone healthcare practice, of course. And we're going to talk about bioidentical hormone replacement therapy. Welcome, Sarah.
Thank you for having me.
How you doing?
I'm great.
You know what the obvious first question is that I'm going to throw out? What is bioidentical hormone replacement therapy? Can you make it easy for me to understand?
Absolutely. Women generally take hormone replacement therapy when they go through menopause. And they may take it during menopause or even after menopause to help with the symptoms of menopause.
Now, I'd heard that.
Absolutely.
But what is this bioidentical thing?
Well, there is a movement that's been going on probably 20 or 30 years or more for natural hormones or hormones that are more similar to human hormones. Premarin, which is the most prevalent estrogen on the market, was originally developed from pregnant mare urine. That's where they got the name.
Pregnant
mare urine.
As in a horse mare.
Equine urine. So it was.
There's something I need to say about that, but I'm not. How did you get interested in this field?
Well, I'm a 47-year-old woman.
Okay.
And
you don't look it, but go ahead.
Thank you. 15 years ago, I was in South Carolina working, and I had patients asking me about natural hormones. And there was a wonderful pharmacist there in South Carolina who saw a lot of women all over the state. And I met with him a couple of times, and I had 5 or 7 patients who would go, an hour away, see this guy, and we would get them natural hormones. Didn't do a lot with it for many years, and now I'm 47 and I'm interested, and I've been looking at it for 3 to 5 years and researching. I've gone to Chicago for what I think is the premier training course.
So you got a vested interest in this whole thing
Sure.
just from life experience. But now I know you gave me the general definition and who needs it, but I guess my follow-up question is, does every woman need bioidentical?
Well, number one, not every woman needs hormones. First of all, there are risk factors, and people who have had certain cancers or have certain cardiovascular risk, heart risk, family history. People who smoke have much higher risk of heart attack and stroke, and so women with smoking habits, we need to help them stop smoking before we can
get healthy before you actually get the hormone replacement.
The hallmark rule for medicine is first do no harm. So I wouldn't give you a medication that could cause you more problems than it would solve.
Interesting. Now, how do I get started? Well, not me, but how would my wife or a family member or a lady get started with this?
Well, the first thing is a consultation. Take a really detailed history. What are your symptoms? Draw blood work. Then you have a second visit where you really review lab results, talk about symptoms and treatment options. And you said your wife, but there are young women after pregnancy who have some hormone imbalances that may benefit. Men certainly have testosterone dysfunction and other problems. And older people have some different hormone imbalances that may help them with aging.
So men might need
absolutely
therapy. Now, is this expensive?
That's the kind of fun part about this. It's around the pricing of generic price drugs. These are old drugs. They are not branded. They are not sold by pharmaceutical companies. You have to go to a compounding pharmacy, and in the kind of style of the olden days, a pharmacist mixes it up.
Yeah, I've been to those
specifically
before.
For you.
There's one in Walkertown. They're all over, but they'll actually mix this stuff up. Yeah,
absolutely. Your private insurance is going to tell you that's experimental, and they won't pay for that. But the pricing, again, is lateral to generic drugs.
Yeah, I just think the more we learn about this, the better off we are. And you've already talked about the compounding. Now, I'm assuming this is once the compound's done, is it then put in a liquid form or a pill form or what?
For women, most of the hormones would either be a pill, or the most common way is creams. And they can be rubbed on the thighs, the arms, different places.
Mm-hmm. Well, I'm learning a lot. Okay, here's some information I want you to know. First of all, Deep River Health and Wellness is in Asheboro, right?
Yes, sir.
And 625-3333 is the number there. But the overall website I want you to go to as well is cornerstonehealth.com. Cornerstonehealth.com. The good folks at Cornerstone bringing us this great segment. I hope you'll come back sometime.
Absolutely.
Thanks
Thank you for having me.
All right. We'll be right back after this.